Welcome to the program. I'm your host, Neal Howard, here on Health Professional Radio. Thank you so much for joining us. Our guest is Dr. Atul Patel. He's a physiatrist. And I'm going to let Dr. Patel give us a bit of background about himself and explain to us what a physiatrist is. Welcome to the program, Dr. Patel.
Thank you, Neil. So to start out, my specialty is referred to as physical medicine and rehabilitation. People also refer to it as rehabilitation medicine, and a person practicing my field is referred to as a physiatrist. So what do I do? Most people know what a cardiologist does, takes care of the heart, or the ophthalmologist takes care of the eyes. What does a physiatrist do? We take care of function. So it doesn't matter how a patient may have lost their function, whether it be from a sports injury, and, for example, if they've sprained their ankle to try and get them back to doing what they want to do, or it could be a neurological condition where they have nerve disease or a nerve injury, or if they've had a stroke or a spinal cord injury, and now they need to be rehabilitated so that they can optimize their function. So that's the type of medicine physiatrists practice. And it's a broad field because people can get injured in or affected in so many different ways, and different parts of different people and areas in my field will help with optimizing the patient's function.
How did you come to be a physiatrist? I mean, it seems like you have to cover the entire body rather than specializing in one particular area. You have to be a specialist in pretty much the entire body, as you say, dealing with function, as the entire body is functional.
Correct. That's right. So after medical school, we do a year of a residency in internal medicine or something like that, and then we do 3 more years of training in physical medicine and rehabilitation. And during that training, we get exposure to different areas, including pediatric rehab, as well as other areas like amputee care with patients with stroke and spinal cord and brain injury, and then patients with musculoskeletal injuries like joint issues and bone and muscle issues. So you cover all that. And then many physiatrists will further specialize and do a fellowship and specialize, for example, in just taking care of patients with spinal cord injury or just with brain injury. But the main focus is on function and can be applied to various different conditions because our body responds in just a limited number of ways after it has been injured or affected. So the principles can be applied to almost all the different areas, but with the knowledge, a fund of knowledge and everything growing so rapidly, that there is now further subspecialization.
With, as you say, the knowledge and the research progressing at such a rapid pace, what about some of the patients who may slip through the crack of some of these developments that could help them?
Right. So what's happening is, unfortunately, there's so much happening with reference to patients needing all these different areas of help, and there are not enough physiatrists in the country, number one. And the other problem is the way physiatrists are trained is so different than the rest of medicine. Most of medicine, the physicians are taught to identify a condition or a disease. For example, you have a broken bone, and then how do you fix it? Or you have an infection like a pneumonia, and what medications do you give and treat it? Whereas with rehab, what we're doing is looking at the whole person and saying, how did that condition affect that person's ability to do things that they want to do now and in the future? And so there is a big shortage of people thinking in that way. And in a way, it's a luxury. So if somebody breaks a bone, for example, they break their hip. Yes, they go to an orthopedic surgeon, they may get that hip fixed, and then after time they do well. But if they have other chronic conditions, it may take longer to get better. And that's where rehabilitation medicine can have an impact on trying to get the patient more mobile and functional quicker and more effectively so that they don't have more issues further down the road.
My next question has to do with a term known as spasticity. Could you talk about this condition, explain spasticity to me?
So spasticity is a condition that occurs in patients after they've had a certain type of neurological injury. So to simplify, our nervous system can be broken up into two main areas, central nervous system and peripheral nervous system. Central nervous system is the brain and the spinal cord, and the peripheral nervous system is the nerves after they have left the spinal cord. If somebody has an injury to the brain or the spinal cord, which is referred to as the central nervous system, oftentimes they will end up with a condition called spasticity. And a quick analogy would be, if I may use electricity. So if everyone can think of a switch, the wire that goes from the switch to the light bulb and the light bulb. So if there is something wrong with the switch, the wire and the light bulb are intact. Mm-hmm. And if we can think of that as peripheral nervous system. So the peripheral nervous system is intact. Your muscles and nerves are working, but the switch doesn't know when to turn on and off, if that's the problem. So when the brain or the spinal cord is injured, the light bulb may flicker on its own and cause increased activity or light when you don't need it. So that can happen with the nervous system too. And what happens in patients with spasticity is that they've lost the central control, but the muscle and nerve wants to keep working on its own or work inappropriately. So one analogy I use with some patients to explain to them is like when they want to turn on the switch in the bathroom and the kitchen, in a patient who's had a stroke, for example, when they turn on the switch, not only does the light in the kitchen and the bathroom come on, but also the dining room and the living room. And you didn't even want to turn them on, but they come on. You have no control. And so in a patient, the spasticity often is described as stiffness. And when they try to use their arm, the affected arm, it may fight against it. So if they want to bend it and bring it towards their mouth, at the same time, the muscles that pull the hand away also want to work. And it makes it very difficult you're almost like fighting internally to try and move the arm. So that's one way to look at stiffness and spasticity.
How does one treat such a thing? Is it just with physical therapy or surgery?
So actually all of the above. So first of all, spasticity, after somebody has, and I'll use stroke as an example because just so that people understand, that's the number one cause of adult disability in the United States. Approximately every 45 seconds, somebody has a stroke in the United States. And stroke is the one, most patients with stroke develop spasticity at some point. And the interesting thing is the spasticity doesn't happen as soon as you've had a stroke. It can occur anywhere from a few weeks to several months after you've had the stroke. And so patients who've had a stroke, they may start noticing stiffness later after they've actually left the hospital. And then depending on when and how severe the spasticity is, there are different treatments. So simple treatment might be physical therapy, like stretching the arm and leg and controlling the tone that way. More aggressive would be medications by mouth that will try and control the tone. And sometimes those are effective, but they often also have side effects, so you have to look at the risk-benefit ratio there. As the spasticity gets worse, some patients may require medications that are more powerful or more effective, and one of them is called baclofen, which you can give them into the spinal cord in the epidural area, and it's called intrathecal baclofen. And that is a small dose going into the spine and giving a tremendous effect of relaxing the muscles. Another treatment is botulinum toxin injections. Many people have heard of Botox, but there are several different botulinum toxins in the market, like Dysport and Xeomin and Myoblock, as well as Botox. And those can be used for focal spasticity, where you inject the muscle and temporarily and partially relax the muscle so that the person can then better use the arm or at least keep it in a better position. And then in some patients, if they haven't been treated for a while, they may have developed what we call contractures. And that's where surgery may be needed initially to open up a joint area and then further treat it with the other medications.
Where can we learn some more about spasticity and about maybe becoming or locating a physiatrist such as yourself?
Yeah. So like I said in the top of the interview, unfortunately, there are not that many physiatrists in the country, But not only physiatrists, but also neurologists can help treat some of these patients. But typically, it is the physiatrist that takes care of more of the rehab issues and spasticity. Patients can find more information through the American Academy of Physical Medicine and Rehabilitation. The acronym is AAPM&R. So AAPMR. They could Google that and look for that and then get information about not only physiatrists in their local area, but also learn more about spasticity. They can also look up just the term spasticity and treatment, and they should be able to find quite a bit of information on that. They can also ask their primary care physician or their neurologist as to where they can get treatment for this. So it could be, if they're having a lot of stiffness, where can they go in their local area to get treatment to help with that tone. And I would also say many of the therapists would also know a physiatrist in the local area, so they can ask their therapist as to where to go. Unfortunately, a lot of the other specialists don't treat this, so it's hard to. It's not as accessible as people would like.
Hopefully, as the word gets out about the specialty, many more people will become interested as they go into medicine. It's been a pleasure speaking with you today, Dr. Patel. Hope you'll come back in the future.
Thank you very much.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. Transcripts and audio of the program are available at hpr.fm and healthprofessionalradio.com.au. You can subscribe to this podcast on iTunes, listen in, and download at SoundCloud. And be sure and visit our affiliates page at hpr.fm and healthprofessionalradio.com.au.